Okay, good morning. Welcome to the Thurston County Board of County Commissioners Agenda Setting Work Session for this Tuesday, September 7th, 2021. It's 9:04 a.m. My name is Ty Mentor, Chair of the Board. Vice Chair Commissioner Gary Edwards is present in the boardroom. Commissioner Mejia is on the Zoom platform. The county manager is excused today. We'll be back later this week. Assistant County Manager Robin Campbell will be with us, kind of navigating us through as needed. The public can follow along on the Thurston County YouTube channel where this meeting is live streamed, and there will not be a board meeting this afternoon. But we will review next week's 2 p.m. agenda as part of this work session. So I think that's all the introductory items. Let's go right through our agenda. Item 1, standing item, COVID-19 update. I saw Dr. Abdulmalik. There she is. I saw Shelley Slaughter, Director of Public Health and Social Services. Good morning.
Good morning, Commissioner. Today is day 580 of Thurston County's COVID-19 emergency response. And here in Washington and Thurston County, we continue to see COVID cases rise. In Washington state to date, there have been 575,490 confirmed cases of COVID-19 since the pandemic began, and 6,691 Washingtonians who have lost their lives. This includes Thurston County cases, which stand at 15,426 confirmed cases, with 693 new cases occurring in the last week. That puts Thurston County at 483.9 on the risk assessment dashboard over the last 2 weeks. Very high transmission. We've had 153 Thurston County residents that have died due to COVID since the pandemic began, and unfortunately, 14 deaths that were reported to us in Thurston County in the last week. 992 Thurston County residents have been hospitalized to date, with 4 new hospitalizations reported to us of Thurston County residents this last week. Our hospital capacity across Washington and Thurston County continues to be very full. We currently have 82 positive COVID-19 patients inpatient at our local hospitals. 44 of those are on ventilators. Our ICU capacity is at 90%, and our regular acute beds are at 100% full, and there continues to be critical staffing shortages. In terms of outbreaks, we've had 80 congregate care outbreaks in facilities to date, 15 that our team are currently investigating. Our test positivity rate is currently 12.6%. Indicating very high community transmission. We do have testing available throughout our community. Our community-based testing team is at multiple locations this week, with Today and Rochester Organization of Families, Roof, tomorrow in Lacey, then Union Gospel Mission on Thursday, and Evergreen State College on Friday. We highly encourage people to get vaccinated if they have not had the chance to do so yet. We are offering vaccinations at both Capitol Mall and at multiple community locations every day. Please check our Thurston County website for the latest testing and vaccine locations. In Thurston County, our vaccine providers have administered 319,822 doses of COVID-19 vaccines, and our current vaccine rates are as follows. 57.1% of our total Thurston County population has initiated at least 1 dose of COVID-19 vaccine, and 52.4% of our total population is fully vaccinated. This does include kids under age 12 who are not yet eligible for the vaccine yet. Of those 16 and over, 68.2% have initiated at least 1 dose, and 62.4% have completed the series. This continues to be behind the statewide rate. 12 and over, 67.1% have initiated at least 1 dose of COVID-19 vaccine, and 61% are fully vaccinated of 12 and over. And I will pass it over to Dr. Abdulmalik to share further information. Dr. A.
Good morning, commissioners. We continue to have high transmission here in Thurston County. Today on the on DOH's COVID-19 dashboard, our community transmission rate is 483.8 cases per 100,000 over the past 14 days. We have been at this level for the past several weeks. This past week, 42% of our new cases were in people under age 30. So we are seeing definitely more transmission in young people than we had in the early days of the pandemic. This last weekend was Labor Day weekend, and so we're watching our county transmission closely, just to determine what kind of bump we might see in our transmission rates. We have seen bumps in our transmission rates after holidays in the past, so we'll be watching very closely. And with that, I am open to answering any questions any of you may have. Thank you.
Commissioner Mejia?
Yes. Shelley, for the testing that's being offered, is it the 3-day testing? Is it the 24-hour testing? What kind of testing is it?
You're on mute, Shelley.
My apologies. Our community-based testing that is offered by Thurston County Public Health and Social Services is primarily PCR testing, which we do send to the state public health lab, and it takes a couple of days to get those results returned. And we do ask that people either be exposed to someone with COVID-19 or be experiencing at least one COVID-19 symptom. Thank you.
Commissioner Edwards?
Yes, sir. Shelley, you made mention that some of the hospital beds were 100% full. Could you clarify that a little bit? Are there certain number of designated beds and they're 100% full, or is the hospital itself 100% full?
So I reviewed our Thurston County COVID hospitalization dashboard census this morning, which the hospitals report into daily to show what their bed capacity and availability is, as well as staffing and other types of things like PPE and ventilators. As of this morning, there were no available acute beds, so regular patient beds. That does not necessarily mean that a patient will not be able to be served, but our hospitals are already creating additional beds and space by converting some of their places in their hospital that aren't normally meant for accommodating patient beds to convert that so they can accommodate patients. So our hospitals are full. The ICU beds, we had a few that were open this morning.
And when you say ICU, those are dedicated to COVID patients?
No, that's total ICU. COVID-19 patients are occupying about 20% of those beds right now.
Okay, and how many beds are there in the ICU? That's what I'm looking for. How many beds do we have, and how many are occupied by COVID patients?
I can pull that up for you, Commissioner. It would just take me a couple minutes to get back onto that dashboard. Those numbers do change. They're not set because they are counted by staffed beds. So they only count a bed if there's a staff to support that bed. And right now, the biggest problem in our hospitals is there's not enough staff to cover all of the patient beds.
Okay. Okay, and I don't need exact numbers, because I don't think numbers are ever exact, but a rough percentage, if you would. How many beds are dedicated at the hospital for COVID? And are those beds full? Are they 10% full or 80% full? Something like that, so we have a real comparison, that the public would have a understanding that it's not maybe heart attacks or other, auto accidents or whatever it might be. So they can have a comparison about what is really going on. Then you mentioned that we're getting more cases under 30, and that must be coming about because of the testing that we're doing is showing that those folks, and they're more than likely, they've got this Delta virus. Is that, so that like 90% have Delta virus that are tested, is that right?
Yeah, I think that there are several contributing factors to the significant transmission we're seeing in younger people. One is definitely the Delta variant, which is well over 95% of the cases of the sample sequenced in Washington State over the last sequencing time period, which usually, because it does take time to sequence, we're usually a couple weeks out in terms of those samples, and it is much more transmissible. The other issue is that folks, so children under 12 aren't eligible for vaccine yet. And many of our young people have not accessed vaccine, even if they are eligible. So in that 12 to 30 age group. So I definitely continue to recommend that folks do get vaccinated because it does protect people not only from the significant harms of a COVID-19 infection, but also makes them much less likely to get infected themselves and then potentially transmit.
Of that age group that's that you're categorizing under 30, is there a percentage of those that have died or been hospitalized, like maybe a higher percentage, or just the mere fact that they're contacting this COVID-19?
So what we're realizing is that when there's significant spread, and so I guess there are two things I'd like to say. So the first is we are seeing increased hospitalizations across the country. So that's definitely a trend that we're seeing in younger people. In terms of that granularity, I haven't. We're definitely still learning more about, specific risk factors and all of those pieces. But the other trend that we're seeing is that people are members of families and communities and friend circles. So when you have a significant amount of spread in one group, it's very easy for the coronavirus to spread to other people, grandparents, places of employment, and things of that nature. And we are seeing more outbreaks linked to unvaccinated folks in situations where they're caring for or are in close contact with colleagues or folks that may be at higher risk for infection or severe disease.
And maybe one final thing. What's the percentage of, I guess you're referring to it as breakout, where somebody has had the vaccination and they still come down with this problem? What's the percentage you're seeing with that?
So at this point, so looking at all of the data from when we started, so the state started tracking this when folks became fully vaccinated, so January 17th of 2021. In Washington State, there have been 21,757 documented breakthrough infections. 86% of those folks had symptoms, and 9% of those folks were hospitalized, and there have been 185 associated deaths. So 99 of those had documented underlying conditions, and there isn't information on the other folks who've died. So we don't know whether they had underlying conditions or not at this time. So there's likely some follow-up occurring in that regard. So it's it's still an exceedingly small percentage, but with the Delta variant, we are seeing an anticipated increase in breakthrough infections.
Thank you.
Dr. A, I wanted to ask you, I've been questioned by people in the community about, given the higher transmission rate among youth and the fact that the folks under 12 can't access vaccine, what is the thinking or behind the, with youth sports was an example. I think I forwarded you one of the communications I got about youngsters playing sports and, coaches in their face and, stuff like that. I mean, what's the thinking behind not having masking apply in those situations?
So at this point, so I will say that as we learn more about the Delta variant and the specific transmission dynamics of this variant, everything is on the table in terms of consideration for mitigating spread. So we're considering some of the data and some of the experiences folks are having in terms of transmission outdoors. So transmission outdoors is much, much less common than transmission indoors. However, it is still essential for folks to do their best to maintain that 6 feet of distance, even outdoors, and wear masks. And there's a strong recommendation for mask wearing when that 6 feet of distance can't be maintained even outdoors. At this point, it's not a requirement, but it's under consideration. So we're looking at, the specific elements of an interaction that would increase spread. So I know that we're starting to see, like in terms of significantly crowded areas, there's discussion of introducing masking for large scale. For large scale gatherings, but thinking even at that granular level, and thank you so much for sharing that letter with me. The guidance is we still want everyone to maintain that distance. So people shouldn't be getting really close and having up close conversations with people not in their household. Even outdoors is strongly not recommended. The concern I know with outdoor sports is making sure that folks who are exerting themselves in that outdoor setting may not comfortably be able to wear masks. So there's a little bit of complexity. There, but in terms of masking when people are not actively exerting themselves or competing is something that's under consideration.
It might be useful for, like, I don't know, in one of your weekly letters or something like that to kind of emphasize that even though you're not, or the guidance isn't requiring that, like re-emphasizing what you just said about the distancing and stuff, because I watch a lot of sports at Capitol because my son's has played sports over the last year, and it just seems like when the masks are off, I don't really see any different behavior amongst the players are high-fiving, that they're huddling up. The coaches are, I just don't see that. It's like, I want the kids to have this opportunity to play sports, and so if a little bit of changed, dynamic can make that happen, then I think we should do that. But I don't think the message is really getting out. And that was kind of emphasized in the email that I sent you, that I don't really think that the message is getting out that, hey, we're not discouraging these activities from going forward. We know they're important, and we think, they can be done a lot more safely if we emphasize A, B, and C along with it. So maybe that's something for one of your upcoming communications.
Thank you.
The second question I had is about, I was asked by community members, and I thought I gave the right answer, but I wanted to make sure I didn't give the wrong answer. So this relates to music performance indoors. My understanding is that all of those, like, we had very nuanced, back before, the more recent period, say last summer and spring, we had very detailed rules about that, a single performer could perform. So anyway, I guess my understanding now is that all of that's kind of not operative. All those old technical rules, it's basically like people indoor public settings need to be wearing masks. And I haven't seen anything that would exempt someone from doing that if they're singing or playing music. So I guess I want to make sure that if music performers were in a restaurant, for example, the people would be sitting at tables without masks because they're eating. The music performers would be able to perform if they were wearing masks during their performance. They're not exempted, but they could do that. Do I have that right? Or is there more is there a more specific stuff that does apply right now to that situation?
So I would say at this time, my understanding is that it is a more general, there is a more general requirement as of June 30th. You can still refer, and in fact, while we were talking, I just brought it up. You can still refer to the old guidance and requirements, which are still useful ways to mitigate spread. And I also just wanted to add that a number of theater groups and performing arts venues have voluntarily put in measures in place to reduce the risk of spread in those settings on a facility by facility level. And we definitely support that in public health. And if particular groups have questions or want to discuss how they can make performances safer, we are happy to, our team is happy to talk to them about that as well.
Okay, yeah, so it's a local business that is asking me, they used to have performances, they'd like to reintroduce them, they'd like to know, they're asking me what are the parameters that they need to follow, and I didn't want to tell them inaccurately.
We are, if you would like to refer them onward to us, we are definitely happy to assist. Okay. If that's okay.
Anything else, commissioners?
Yes, Chair, I do.
Go ahead, Commissioner Edwards.
Are you folks following what's going on in other parts of the world with this virus, like India and Japan, and maybe some of the approaches that they're taking, and possibly analyzing that to see how it fits with what we're doing? Do you follow any of that stuff internationally?
So I do follow it internationally, and a lot has to, yes. So I am, and there's a lot of so the key parts of mitigation are kind of the distancing, prevention of spread through different barriers, and then availability of testing. And so it's interesting. So I definitely follow how different countries utilize those mitigation tools in a way that's specific to their conditions.
Okay, and I guess I and I guess the other commissioners as well got a correspondence on Friday from a county employee that's got some very good information in it, but he asks some very serious questions. And I'm wondering, are we going to be able to refer to you or your staff, Shelley, for answers to some of these questions?
I'm going to interject, Commissioner. I've been in contact with the county manager on that topic. We're working with HR, and we will get back to the board soon.
When you say soon, do you have any idea, Robin, when that might be?
Got a message from Romero this morning that he is setting up a meeting to discuss the series of emails that we've received since Friday.
Okay, that sounds good. And looking forward to that. Thank you. And at that point, we'll be able to contact, see what kind of follow-up we're going to do with our health department.
We'll circle back with the board on what type of response is appropriate.
Okay, thank you very much.
Okay, hearing nothing further. Thank you, Shelley. Thank you, Dr. Abdelmalek.
Thank you.
Homeless Strategies is next. Keely Marino, healthcare champion, as she was awarded last week, is with us. What's going on, Keely, in homeless world?
Good morning, Lee Marina with Public Health and Social Services. And I just have a few things for you this morning. Just as we do on a weekly basis, just a little bit of an update on the rental assistance program. So today I'm just going to report on Community Action Councils. I did not get an updated report from CYS, but Community Action Council has at this point served 1,818 households in Thurston County with rent assistance to the tune of $12.5 million and another $500,000 in utility assistance. So other than that, I'm really pleased to introduce a new program that is occurring as a partnership between Interfaith Works, MultiYear Capital Medical Center, and Providence St. Peter Hospital. We're hoping that the county is funding the program with hopes that FEMA reimbursement will be able to cover this program called Restorative Experience for a Safer Transition, which is acronym spelling REST. So the REST program will provide beds for discharged patients meeting certain criteria, giving them a safe place to recover, and coordinating social service support, hygiene services, and meals during their stay. So what that means is that for those people who are needing to recover from whatever it is that ails them at our local hospitals, and they do not have a home in which they can be just discharged to, they're being discharged to this program. And Interfaith Works staffed by Providence or by MultiYear, and Interfaith Works staff are providing those services wraparound in a local hotel. So very excited that that's getting off the ground. All of the Providence beds are full at this point. So they're still getting it up and running, but it is already in operations, and just wanted to let everyone know about that. And that is my report for today.
Commissioner Mejia,
No questions. Thank you, Keely.
Commissioner Edwards.
Yes, Keely, could you give us a breakdown possibly on what kind of interaction you have with these homeless camps, the encampments that are set up on like state right-of-ways and things like that? Are we, apparently we're delivering stuff to them. I don't know what that stuff is. I'd be curious what that entails. And are you running all around the county? I mean, Capitol Forest and Yelm, all around to all the different encampments, or how do you get those people on your list?
Excellent question. I'll try to be quick. So there are a number of agencies that provide those types of services, some of which are funded through our office, the Office of Housing and Homeless Prevention. So most camps predominantly located in Tumwater, Lacey, and the city of Olympia are serviced by these providers. They are interacting with outreach workers and receiving survival gear or water, referrals into other programs, which could be behavioral health treatment or substance use treatment or housing, coordinated entry. Those programs are pretty broad, and there's approximately 4 agencies that do that work actively in the encampments. And as far as I know at this point, we were, prior to the pandemic, going out to Yelm on a regular basis. And when I say we, I mean the outreach workers, not myself. And that's as far south as we've gone. But when the outreach community hears about a new camp in our county, they do everything they can to ensure that they are being interacted with and engaged with.
Okay, thank you.
Thank you, Keely. Let's move forward then. Next on the agenda is a review of next Tuesday's draft agenda, September 14th. Meeting would be called to order 2 p.m. Consideration of the agenda and board meeting minutes from August 31st. A number of presentations are slated. First is proclamation for Day of Service and Remembrance.
Okay, so Romero will be presenting a proclamation on the Remembrance Day for September 11th or 9/11. Believe it is the 20-year anniversary this year of that date, and I don't know if anyone will be here to receive that.
Okay, I see a draft in our packet just for commissioners' benefit. Commissioner Mejia, any questions or about this item?
I think just a suggestion, I feel we should invite our local firefighters to accept this, and you know, I feel like this day does impact everyone, but I feel, you know, it also, they lost a lot of colleagues during that time as well. Just a suggestion.
Great, thank you.
Commissioner Edwards?
No, thank you.
Okay, second item is proclamation for Hispanic and Latino Heritage Month. That's also in our packet.
So Amy, do you have any information on this one? Is Amy in the room?
Yes, she's getting her microphone.
Hello, Amy Davis, clerk of the board. No, we do not have anyone confirmed yet to attend. I was going to reach out to Commissioner Mejia's office and see if there were any groups you'd like me to reach out to prior to next week.
Yeah, oh, we'll be in touch.
Sounds good.
Great, thank you.
Any other questions about this, Commissioner Edwards?
No, sir.
Emergency Services is next. Introduction of Medic One employee. Kurt Harden is here. Emergency Services Director. Good morning, Kurt.
Good morning, Commissioners. Kurt Harden, Director of Emergency Services. Next Tuesday, we'll be introducing our newest employee, Medic One. Although he started in May, but due to all the other requirements we had to get him through and training, et cetera, we're now getting him into the board for you to meet him. So Jarrett will be available next Tuesday. Highly qualified person that came to us from east of the mountains, but relocated over here. So you'll have an opportunity to talk to him.
Anything on this, commissioners?
No, sir.
No, sir.
Thank you, Kurt. Next will be a similar item for public defense, introduction of a series of public defense employees. Don't see Pat here, but that should be straightforward. Looks like he's got several new people to introduce. And Public Works, the same. Looks like Scott Lindblom is here and will be here, County Engineer. Scott, what will you be presenting?
Good morning, Commissioners. Scott Lindblom, County Engineer with Public Works. I will have the opportunity to present 12 new Public Works employees that have joined us in the past few months, including 4 staff from the Office of the County Engineer, 4 in Water Resources, 3 in Road Operations, and 1 in our Financial and Asset Management team.
Okay. Questions, commissioners?
No, sir.
No, sir.
All right.
Thank you.
Looks like we better find some office space. A lot of new folks coming on board. Okay. Next will be opportunity for the public to address the board and the county manager's update. Robin, do you know of anything that Ramiro wants us to know this morning?
I am not aware of anything at this time.
Okay. Then we'll look at our consent agenda. We have items 3A through 3E. 3A is an information technology item, interagency agreement with the city of Yelm for regular and ongoing exchange of geospatial data. Dennis Osorio, Director of IT, is here with us. Go ahead, Dennis.
Good morning, Commissioners. This is just a renewal of a data share agreement for geospatial information that we share with the City of Yelm. We do it with most of the local cities here. So it both helps them and helps us and helps numerous offices and departments with being able to access this data.
Question, Commissioner Mejia?
No, sir.
Commissioner Edwards?
Is there a fee or anything? Does money change hands for these?
No, Commissioner.
No? Okay.
No.
Thank you.
Okay, thanks, Dennis. Sounds straightforward.
Thank you.
Item 3B is Human Resources and updated telework policy. Maria Ponte, Human Resources Director.
Good morning, Commissioners. Next week, I will be presenting on our updates to the telework policy. The original one is from 2000. And so I worked with offices and departments to gather input and what they would like to see included in this policy. We had great participation. And I believe what I'm presenting next week is a good balance between operational county business and providing management and employees with flexibility. Also made some updates to security of county equipment to include things like multi-factor authentication.
Commissioner Mejia,
No questions.
Commissioner Edwards.
No, sir.
Maria, is this an update to something that was pre-COVID, or is this an update to maybe something we put together quickly last year?
Pre-COVID, we were looking at updating it just because a lot of the terminology and things were outdated. Once we went into COVID and we saw great numbers of county employees teleworking and successfully teleworking, I think what happened is we've just gotten more management buy-in, and because of those practices, we were able to include things like protocols for virtual meetings, ensuring that, if you're working from home, that you're securing confidential information that you may have. So it's a combination of all things.
Will we get a copy of this before next week? It may be, I was gone Friday, something may be sitting in my email, but I haven't seen it yet.
I did include it. I'd be glad to forward you the Word version of it.
Okay, I would appreciate that.
Okay.
Chair, could that go to all the commissioners, please?
First.
Yeah.
Absolutely.
Okay, very good. Thank you, Maria. It sounds like you're on deck, though, for item 3C. Civil Service Resolution for Revised Classification Specifications.
So that is today's agenda in error. We were working to try to strike that. So there is no presentation of those classifications. We will be doing so board briefing into the future, but I think that was pending and it just somehow made it on the agenda in error.
Perfect. Thank you, Maria. Okay, items D and E are the voucher lists. Anything that the commissioners want to bring up?
Yes, yeah. Okay.
Any questions from commissioners on 3D or 3E?
No, sir.
No, sir.
Okay. Then we'll move into item 4. It's an assessor item, single source service agreement with Just Appraised.
Morning, Commissioners. Dan Janiga from the Assessor's Office. I'm the Property Administration Manager. Our office is seeking approval of a single source software subscription with Just Appraised. The basics of what that is. So one of the many things our office is responsible for is updating property ownership and tracking the sales that happen in the county. This is a software service that will help eliminate a large part of data entry. Legislative changes to exemption programs and things like that, starting in 2022, are going to increase our workload substantially. So we've been trying to figure out ways to take that on, and this is a way of doing that. Basically, what it does is it's able to read documents, deeds, excise tax affidavits, and any other recorded documents, sort them for us, pull the data from the documents, insert them into our database, analyze the sales for the type of sale, that type of thing. And so then all our staff needs to do is just review that quickly and make a note of whether it's correct or not correct. This software has the ability to learn. So if it wasn't correct, it'll figure out what wasn't, and it'll learn as it makes mistakes as it goes forward. It's kind of neat. So it will allow our staff, instead of typing in, the data, they'll be able to work with the taxpayers for the exemption programs, and, use their expertise instead of just as data entry people. So.
Thank you, Dan. I see the county assessor, Stephen Drews here. Steve, anything you wanted to add?
Yeah, I just would stress that this pretty amazing software, and it decreases process time for the public, so better customer service. It helps us ameliorate a staffing challenge as work increases at much less cost than an additional FTE. And so this is a very economic solution to the growing workload in our office on Dan's side of the office. And our intention is to enter the annual contract before the end of the year with available funds and vacancy savings for this year. And our desire is to have the future years rolled into our central service rates. And I think as a practical matter, this will be part of your budget package ask. But as a practical matter, because of where we were in the year, I think that 2022 would be added to our budget and then funded from our budget. And 2023 would be in central service rates if you approve our budget request. We don't have confidence that we'd have the ability in the additional years to continue to fund this asset for our operation. But we do have the ability in the initial year to get it launched. And so we'd appreciate your yes on this ask and also on the budget ask that's related to it.
Commissioner Mejia?
No questions. Thank you.
Commissioner Edwards?
Yes. Is there any chance that this new technology will prevent exposure to COVID in one way or another, either through interaction individually with people that have come into the office and interact with our staff? And if so, I would ask Robin, if we're going to be a budgetary issue, is there any chance we might be able to get, I don't know, the first couple of years worth at least out of the CARES fund instead of general fund?
Yeah,
Go ahead, Dan.
yeah. I would say no. This is, the employees are reviewing the documents, and they're doing this remotely already. This is a way. Some of them are doing it remotely. Some of them are in the office. This is just a way to speed that process along, so they're not having to do the data entry spot or part of the job as much, and they can just be experts helping people at the counter more, and I don't know, use their brains more than just typing in numbers and letters.
Yeah, the only thing I would add is in the rare occurrence that the entry of the information and the recording of the information in our database is an issue for a larger pending sale, this shortens the processing time. But I doubt that it's enough, Commissioner, although I'm not the expert on the subject.
Okay, thank you. More to come, sounds like, too.
Robin, since this has a budget component to it, anything that you wanted to make?
No, I think Stephen laid out very well. This is an item that he has, he's absorbing this year. He has proposed for additional funding for his office for next year, and that will be part of the board's consideration as you review the budget.
Okay. Yep, I think the assessor pretty much hit on the questions I had as well. So anything further, we'll just, this will be on next week's agenda.
Thank you.
Thank you.
Okay, let's go to item 5A, Central Services, Mottman Complex Feasibility Study. And Jason Ash is here from Central Facility Services Manager.
Yes, Commissioners, good morning. On Tuesday, I'll be coming to you asking you to approve an amendment to the on-call contract, authorizing the Assistant County Manager to sign it for a a feasibility study for the Montman complex. This will give us a rough cost of what the auditor elections department is asking for, along with the rough cost of what it will take for facilities and records to move into the Montman complex. Do you guys have any questions on it?
Commissioner Mejia,
No, sir.
Commissioner Edwards?
Yes, is this one of the issues about unknown continuing costs that came along with the purchase of this property? Is that part of it?
So it is, Commissioner, it is, Auditor Hall has certain needs for these buildings and has requested some upgrades to the buildings. We also know we want to get records and facilities moved in, and it would behoove us to have a professional design developed working with the three entities that will share the space before we make any investments.
And who are those three entities that are going to share that space?
The auditor, the facilities, and records. That was the intention when the board approved the purchase of the property.
And has there already been money set aside to deal with this portion of I guess it's part of a remodel or something, right?
It would be part of a remodel and it would be paid. Auditor Hall has been quite successful in grants or part of the bond money. We need to get a price tag so the board can consider how far you want to go with this.
Well, this dollar amount here, 64,000, that's not the price tag we're talking about?
That is the price tag for the design, not for the remodel.
And then from this, we're going to come up with the price of the remodel. Is that what I'm hearing?
That's correct.
Any rough ideas or anything and where this fits in the budgetary process?
We have put a $10 million placeholder in the capital improvement plan, which you have reviewed. We have no idea if that is way too much or not enough. It is simply a placeholder until we get a professional to get a better idea of what it is that the auditor expects and someone who can help us price it out.
Okay, thank you.
Price tag for the price tag.
Yeah.
Okay, well, I understand it. So no other questions. We'll move forward. Thank you, Jason.
Thank you.
Okay. Next page, emergency services, interlocal agreement with Thurston Regional Planning Council. Kurt Harden's back.
Good morning again, Commissioners. Kurt Harden, Director of Emergency Services. This item is requesting that the Board of County Commissioners approve an interlocal agreement with Thurston County Emergency Management and the Thurston Regional Planning Council for the time period May 1st, 2021 to March 31st, 2024 in the amount of $166,611.08 for services related to the Regional Multi-Jurisdictional Hazard Mitigation Plan. It also authorizes the Director of Emergency Services to sign the agreement and any amendments that do not exceed 10%. The Regional Multi-Jurisdictional Hazard Mitigation Plan is a FEMA requirement and it's updated every 5 years. And the FEMA plan is required to receive, for the county, to receive any federal disaster mitigation funding within the county. We are in that update window for this plan, and the TRPC will coordinate, facilitate research, compile data, write, and manage the update of the hazard mitigation plan for the Thurston region and its stakeholders. Also, this interlocal agreement is funded by a federal grant that the board approved on July 20th, 2021. Subject to your questions, that's what will be presented next week.
Questions, Commissioner Mejia?
Kurt, one question. So I see it's for a couple of years, 3 years?
Yes, it's multi-year.
Multi-year, okay. I was just wondering if that's the way it's multi-year contract.
It is because of the update process. Typically, the update process takes longer than 1 year.
Okay, thank you.
Commissioner Edwards.
I think Kurt has answered that. That's being funded through a grant process, you say?
Correct. It's being, yes, sir, Commissioner. It's being funded through a federal grant that the board approved on July 20th of this year. And it's typically, we get this federal grant in every 5 years to update the plan.
Okay, and the portion we're doing here is just making the agreement with Thurston Regional Planning, I take it.
Correct.
Okay, thank you.
Kurt, I know this is not the same agreement, but we worked earlier in the year, I think it was on the Disaster Recovery Council, the Interlocal Agreement that was going around. Can you give us a little update on that? Did that
Sure.
get signed by everybody, and is the money, I know it was like a certain amount of money we were going to be contributing to stand it up. Is that going to come up in the budget this year, and et cetera?
Sure. That agreement that the board looked at in June, we've got all the minimum 5 signatories required. And so that is moving forward. That's enacted. And also that is being funded by federal grant money as well. That's already part of this budget year. And so that's being stood up. And TRPC also is working on that Disaster Assistance Council project. And so they're part of that too. And so we just got the last signature, shouldn't say the last, but we just got the most recent signatory, I think in July. So that's just moving forward now.
Okay, very good. That takes care of 6A. Thank you, Kurt.
Thank you.
7A is Public Health and Social Services, contract with Community Action Council of Lewis, Mason, and Thurston counties for rent and utility assistance. I see Shelley as well as Tom Webster. Go ahead, Tom.
Good morning, Commissioners. Tom Webster with Public Health and Social Services. So we're here to bring to you next week a request to sign a contract with Community Action Council for $6.9 million for rental assistance activities. So a little bit of background you've been hearing from Keely and her updates on the rental assistance program. As you heard, Community Action Council has spent already around $12 million of the funds under the TRAP 1 program. That's the Treasury Rental Assistance Program. We expect that they will spend out of those funds that they were awarded back in February, March, in the next week or in the next couple of weeks before the end of September. So this award is Thurston County received a direct allocation from the Department of Treasury under the TRAP 2 program. And so this is funding to allow Community Action Council to continue the rent assistance activities using the TRAP 2 money. It's a new contract because there are slightly different program rules and it was under a different funding source from Treasury, even though there's substantial overlap between the two programs. And that's why it will be a new contract rather than an amendment to their existing contract. I also want to let you know that in the coming weeks, we'll be bringing you additional motions for your consideration for additional rental assistance activities. We're anticipating receiving a contract from the Department of Commerce for TRAP 2 monies in early October, as well as an amendment of additional TRAP 1 money from the Department of Commerce. So this is the first of several AISs that we'll be bringing forward with additional rent assistance money for our community, as we'll be close to spending out the $18 million that was allocated earlier this year by the end of the month. We have been in constant communication with Community Action Council over the last several weeks to make sure they have sufficient capacity to manage these funds. Community Action Council has indicated that they do have that capacity. They've committed to making sure folks can get an appointment within 2 weeks and the phone calls are returned in a timely manner. So we have been working with Community Action Council. Community Action Council has also shared with us several emails of appreciation that they've received from households that they have assisted. And we're happy to share those with you if you would like to see those. And with that, I'm happy to answer any questions.
Questions for Tom? Commissioner Edwards?
No, sir.
Commissioner Mejia?
No, sir.
Okay, thank you, Tom.
Chair, I do have a question on one of the department issues.
Go ahead.
For the verbiage on the assessor's issue, do we want to continue to leave that 45,000 annually in that particular motion? And the only reason I ask that is it seems to be a budgetary item that's getting ahead of the process. But I might have that wrong. I'm just trying to get it right because I'm the one that might make that motion. I guess that's a Robin question, I suppose.
So the assessor is asking for permission to enter into a contract that will have an annual price. So this is actually stated correctly. However, should the board decide to not fund it in future years, then the assessor will determine if he can either continue to absorb, which is he shared with you he does not believe he can, or if he will terminate the contract. So he'll have a choice to make in the future, but the way this is worded is accurate.
Okay, thank you for that clarification.
Thanks, Commissioner. Okay, then let's go to item 8A, Public Works description is contract award for the Burfoot Park Restroom Replacement Project, CP 51077. Kevin Forbes Kashani, Associate Civil Engineer, is with us from Public Works. Good morning.
Good morning, Commissioners. Kevin Forbes Kashani, Associate Civil Engineer, Public Works. On August 12th, 2021, a total of 8 bids were received to construct the Burfoot Park Restroom Replacement Project. The low responsive bid was received from Construct Inc. of Tumwater, Washington, with a bid of $751,693.96. Burfoot Park currently has 1 restroom accommodating 4 users, and this restroom is out of compliance with current ADA regulations, and it also has site flooding due to this improper grading. The project will replace this existing restroom with 2 new restrooms that will address these issues and will also accommodate increased park attendance, as the park's restrooms will now accommodate 8 users. This project is completely funded through the park's impact fee and real estate excise tax, or REAP 2 funds for 2021 at a ratio of 65-35 respectively. This project is in the 2021 Public Works budget and the 2021 Capital Improvement Plan, and is in alignment with County's Strategic Plan, Initiative 7, to balance development with the preservation of the county's rural character, natural areas, and open spaces, and Initiative 8, to support robust and well-maintained infrastructure systems for a thriving community. Please let me know if you have any questions I may address.
Commissioner Mejia?
None right now, sir.
Commissioner Edwards?
Yes. What was the highest bid that we got on this, so the public knows we're getting a good deal?
Yes, of course. Let me pull up the bid tabulation right now. Our highest bid on this was $1,247,149.33.
Okay, well, good job on that. And I have one other question, though. I know you've got the funding roughly divided out from 2 categories, but it seems to me when we've made ADA upgrades in the past, we've been eligible for some funding from, I don't know the name of the fund, but something to do with ADA. Do you have any information that you could throw in there? The only reason I ask that is because if we could save some of that REAP funding that we could use maybe on another project, that we would not have eligibility from another funding source. So do you have time to look into that to see what might be available?
Of course, I could look into it. My assumption would be that we've got a federal grant for that project. Like myself, I'm working on another project where we're doing ADA improvements within the sidewalks. Sorry?
Yeah, no, good. I mean, that's what I'm.
Yeah. And for that, we had a federal grant that we had to apply for that wouldn't be applicable to this project.
Okay. Well,
but I can look further into it.
Yeah, we could look further into that. And even though you've done a great job on getting the price down a little bit, different funding sources could help the community as well. So thank you.
Of course. Thank you.
Even what was the projected amount for the project? I feel like this is pretty close to what I remember it was going to cost, but sometimes I get numbers mixed up.
The projected engineer's estimate was just shy of $1 million, 999,500 and let me check, $545.40 to be exact.
Okay, so we didn't just beat the high, we beat the estimate. So that's good.
Correct.
Thank
Yep.
you.
Thank you.
Okay, very good. That is it for the substantive items. It'll be a fairly long meeting, I think, with all the presentations. Standing items will be addressed, and then we'll go to Board of Health, which will begin at 3:30 or shortly thereafter, based on the 2 p.m. meeting. So let's try to review that Board of Health agenda before we take a break. That meeting would be called to order. Approval of agenda and meeting minutes from August 10th. We will have a proclamation for Suicide Prevention Awareness Month. And Shelley Slaughter is here, Marianne O'Gara also from Public Health. Shelley, what do we need to know about the proclamation?
Thank you. Good morning again, Commissioner. Shelley Slaughter, Director of Thurston County Public Health and Social Services and Administrator of the Board of Health. And September is National Suicide Awareness Prevention Month. And so this proclamation, we want to raise awareness of suicide in our community and share information about resources. Suicide is the 8th leading cause of death among Thurston County residents and the #1 cause of death amongst 10 to 17-year-olds in our community. We've also invited our County Coroner, Gary Warnock, to come and share information about suicide. And I don't know if, Marianne, there are some other community members who will be in attendance for this proclamation. Marianne, anything else you would like to add?
We have been working also on training community members on question, refer, persuade, a model that allows people to share with community-based residents some simple ways of understanding how to prevent and recognize suicide warning signs. And so one of our partners in that process, Family Education and Support Services, is going to be coming along with some of our newly trained QPR trainers to share with you that as one of the ways we're being very proactive about preventing suicide. And that is one of the other things that we're doing, because it's about sharing resources, improving our community capacity, as well as just raising awareness.
Any questions about that item?
No,
sir.
Okay, then the opportunity for the public to address the Board of Health. And then we have our standing items. So we don't have a particular presentation on a substantive item. Shelley, anything you need to let us know about what you want covered here?
Yes, sir. We have a placeholder for 2 additional items that we had discussed at our planning meeting for this, and that includes that it is also National Septic Smart Week, the week of September 20th, and we want to highlight the importance of people learning how to maintain their septic system, and also a presentation from our environmental health staff on that. So we will be getting that information submitted onto the Board of Health agenda for next week and can review that again with you next week. My apologies that that is not on the agenda, but we do plan to include that. And then, of course, we will follow our normal Board of Health items, the health officer report and my report as well.
Is the septic smart, if I remember correctly, isn't that in the form of like a proclamation?
Yes, we typically do a proclamation for Septic Smart Week. And so we will have that item followed by a presentation.
Okay, any questions from the commissioners on the rest of the Board of Health agenda?
No, those proclamations, can I see them beforehand since I'm gonna be the one who has to read them? Thank you.
Absolutely, we will get those to you.
Thank you.
No questions, sir.
Okay, let's keep going then. Thank you, Shelley.
Thank you.
We've got proclamations and awards. Clerk of the Board, Amy Davis, are you there in the boardroom?
Yes, I am. Good morning, Amy Davis, Clerk of the Board. The proclamations for next Tuesday, September 14th for Day of Service and Remembrance and for Hispanic and Latino Heritage Month are included on the draft agenda. I will make some grammatical revisions prior to then.
Anything for Amy regarding those two? We already kind of covered that. We've got voter registration day also in our packet. Is that coming up?
Yes, at the end of the month, we'll receive a proclamation from the auditor's office for that.
Okay, and that covers September. Any questions from the board on the proclamations? Besides what we've already covered? No.
No, sir.
Okay. Let's go to advisory boards and commissions.
There are no items for review here.
PIO check-in.
Good morning, Commissioners. Megan Porter, Public Information Supervisor. I have no updates for you this morning.
Any questions from the board for Megan?
No, sir.
No, sir.
Okay. Assistant County Manager, anything regarding briefing or public hearing decisions pending?
Nothing pending at this time. Thank you.
Okay. Then it's 10:11. Let's take a break and reconvene at 10:25. We'll pick up with the commissioner items.
You're live, Commissioner.
Okay, thank you. Welcome back to the Thurston County Board of County Commissioners agenda setting work session for Tuesday, September 7th, 2021, 10:25 a.m. And we're picking up with commissioner items. We have a shorter work session today, and then we'll have a budget meeting at 11:30. But the first commissioner item is Martin Way Phase 2 Project Award Letter discussion. Tom Webster from Public Health Social Services is here to introduce what's going on here. Go ahead, Tom.
Good morning again, commissioners. So a little context, Lehigh Low-Income Housing Institute, as I believe you're aware, is currently constructing a multifamily affordable housing project at 2828 Martin Way for phase 1, which is around 64 units of housing along with shelter units. They have a phase 2 project that they are working on putting together the financing for. Earlier this year, they submitted an application to Thurston County and were awarded $1 million for their phase 2 project. They're currently in the process of applying to the State Housing Trust Fund and to the Washington Finance Commission for low-income housing tax credits. Since they submitted their proposal to the county last February, construction costs have gone up, and they are now faced with a approximately $1.7 million funding gap. They know the maximum amount they can request from the trust fund and the finance commission. And so in advance of submitting their application to those two agencies, Lehigh submitted a letter to both the Regional Housing Council, Thurston County, and the City of Olympia, asking them for support to fill this funding gap. This was discussed at the Regional Housing Council last week in late August. And the Regional Housing Council is recommending that $1,406, so this is the local sales tax that is retained from the state and not sent back to the state, that can be used for affordable housing, be used to fill this gap. The jurisdictions under the Regional Housing Council Interlocal Agreement have agreed to pool their 1406 funds. It is estimated that as a region will collect between $800,000 and $900,000 per year in 1406 revenue. So this would require the use of all of 2021's 1406 revenue and a portion of 2022 1406 revenue. City of Olympia is anticipated to also contribute some of their 2020 1406 revenue in the tune of around $290,000 to $300,000, so that the 1.7 million will actually be a little bit less. City of Tumwater may also make a contribution. So we're not sure of the final amount of the regional 1406 that would be required for this project. Probably end up close to being in the $1.4 to $1.5 million range after other jurisdictions also contribute funds. So what we're asking is for your approval or authority to have the county manager sign this conditional letter of commitment to Lehigh, saying that the region intends to commit to help Lehigh fill this funding gap. This would be $1,406. This would be a conditional commitment, and it would be subject to final approval from the Board of County Commissioners before contract is signed. Some of those key conditions would be that the project would need to obtain full funding, so they would need to receive full funding from the trust fund and the tax credits before we would issue a contract. We'd also require that these funds be the last money to go into the project, so that if there were cost savings right now, I think folks are aware that lumber costs, construction materials are high. They are starting to come down, hopefully. If construction costs come down so that all of this money is not needed and construction costs are lower, this would be the last money in. And so any money that would not be needed could be returned to the county for other projects. So those are kind of the key kind of elements with this. Happy to answer any questions. So what we're really is asking for your approval for the county manager to sign this conditional letter of commitment to Lehigh. This project would not start construction until late in 2022. So a little over a year from now is when they're scheduled to start construction.
Commissioner Mejia.
No, sir. No questions.
You were in the Regional Housing Council discussions about this
Yeah.
and support this idea.
Yes, sir.
Commissioner Edwards?
Do we have commitments for this 1406 money for this time frame?
No, no other activities or projects that have been identified for the use of 1406 funds for the 2021 or 2022 funds. So no other projects have been identified for the use of those funds at this time.
And do we have any residency requirements before we put people in this low-income housing? Can anybody move here from Portland and sign up and they get same preference as someone that's been in hard times for the last 5 years, say?
So placement in these units will be, we'll go through our coordinated entry system. So folks will be prioritized based on their vulnerability and they will need to be in our system. And so there's not a specific residence requirement, but will be tied to our coordinated entry system. And those folks who have been living in Thurston County who are part of the coordinated entry system are those that will be considered for that. So for someone from another state couldn't just come in and get put kind of at the top of that list unless they were moving to Thurston County.
Yeah, that's just it. If they move to Thurston County, then they get to cut in front of the line for somebody maybe that's been here waiting. I guess my concern is that we do not encourage people to come here to take advantage of our goodwill. So if we don't have anything in place, I'm not going to be able to support that. I just want to say that up front. So whatever it's worth, I think that we need that type of protection in place to prevent abuse of the system. If you can come up with something, I'd sure like to hear about it. Thank you.
Yeah, I don't know how we would enforce that, and that we'd have to look at other kind of funding requirements for the federal and state funds that we do receive, and what the requirements would be. But I understand that's a concern. I'm not sure. We'd have to have more discussions to determine how that would be implemented.
Okay, more to come, sounds like. Thank you.
What's our time frame on your needing direction from the board? It says discussion on the agenda. Did you need our decision on this this morning?
Yes, we do. Lehigh is submitting their application to the trust fund on the 15th of September, and so they need this letter of commitment. It will strengthen their application by showing that they've identified the full range of funding sources in addition to trust fund and tax credits. So having this letter of conditional commitment prior to the 15th will strengthen their application and increase the likelihood that they will receive an award from the trust fund and the Finance Commission. So we are asking for approval to sign this letter and submit it to Lehigh prior to the 15th.
Okay, so I guess board thumbs is going to be required here. I see one thumb up, two thumbs up.
And that gives you your majority, and I just can't vote for it without some type of restriction on encouraging folks to come from all over the country to take advantage of our goodwill. So.
Okay, we have your direction. I mean, I just as a comment, I would say that the 1406 money was committed to be pooled, which was a great regional partnership, and it never really got going in 2020 because of COVID. And I know we allocated kind of separately some of the money from 2020 without abandoning this concept of having coordination toward a program with regional impact. And if this is the project that is going to be most impactful, it's frustrating that construction costs have gone up and the money's not going to go as far. At least we're not seeing that right now, but this seems to be in line with what the original vision of pooling those $1,406 together with our municipal neighbors was about. So that's why I'm supporting this. It sounds like you have a majority support there, Tom, to let Ramiro know he can finish executing that letter.
Great. Thank you.
Public testimonies next. I don't know what there is, if there anything, Robin.
I have nothing, commissioners.
I don't recall anything offhand that needed discussion. So other commissioner items, we have time here if we need it. Our next scheduled meeting is at 11:30, but any commissioner items, start with Commissioner Mejia.
No, I wasn't prepared. We never have time, so. I didn't have any items prepared.
Commissioner Edwards.
It sounds to me like Robin and Romero have a plan already to address the topic I was going to bring up today to discuss, but so shy of that.
Is that the emails you were talking about from Friday?
Yes.
Because I was out of the office Friday. I don't know what you're talking about. I can look at it later, but if you want me to know, if you want me to participate in any meaningful way, I'll need to know what you're talking about.
Sure, and that's fair. I guess what I would do is I just would encourage my seatmates to read the email. It's going to take you about an hour to read it. It is a very well put together piece of information that has to do with our mandate on the vaccination. So a lot of good information is from a county employee that's been here quite a few years, management person. I just think he did an excellent job on research, and I am always open to information. I'm one of those guys that's dead set against censorship, so I like the idea that he did the research and provided the information for us to review. And I guess more to come, I guess is the best I can say, because we can't have a conversation if, nobody's familiar with it.
So Romero and I are requesting that you hold off on discussing this topic until we're able to do a little more coordination. HR, we've talked to HR, we've talked just a little bit to legal, and we will be, I think Romero set up a meeting for us to discuss with HR and legal what the next steps are. We will come back to the board when we have that. So please let this hang on till we have more information for you.
Okay, I guess I just follow up that it's just good overall information about the country dealing with this virus. It was sent to us by a county employee that's very concerned, and I'm going to differ with Robin. Just there's nothing wrong with people being educated. And that's what it's all about. It's that person's
There is
concern.
A difference of opinion, Commissioner, on whether or not the email that was sent contains information. So please, let's stop.
I'm going to say it does contain information. And the information can be clicked on, and you can review it and see it yourself if you want. I mean, for those that have a closed mind, it's not going to be something you want to look at. But if you're open-minded and want to hear what others are saying about what's going on in our country today, I believe it's worth looking at. That's all I'm saying. Thanks.
I look at every email that comes into my box, so there won't be any problem with that. I'll look at it. So I have a few. We'll just go around. So my next one is Ramiro may be on top of this too, but I've been getting emails that talk about the Black Lake Special District and the fact that a petition that was referred to by the citizens, and we discussed this a little at the end of last week, but the emails talk about something about that petition triggers the requirement that we have a public hearing. And I forwarded the email I got to Ramiro and Elizabeth Petrich from a prosecuting attorney, maybe Travis is the one that knows about this, but I just want to make sure that we are addressing that because the citizens were suggesting that the petitioners were suggesting that we're required to have a public hearing based on what they submitted. I'm not sure if that's true. I haven't had a chance to look at the statutes involved and whatnot, but it's obviously something we'll need to just touch base on as a board.
So I'm not aware of this. I've made a note and we'll follow up and get back to you.
Okay. And yeah, the county manager and Ms. Petrich should have the email that was sent to me a week and a half ago. Commissioner Mejia, you don't have anything? Commissioner Edwards?
No, I'm fine, sir.
Okay. Two more quick ones, just mainly just because Ramiro's not here, but I wanted to make sure that the letter that we're going to be sending to the cities about the public hearing on the county home fund concept goes out as soon as possible, because we're asking their councils to consider and take action and provide input. I want to give them maximum amount of time to do that before, I think it was October 19th we landed on. But so that'll be the first thing that I touch base with Ramiro on, because I haven't seen a draft of that. So I assume it has not yet gone out. And if it hasn't, it definitely needs to go out this week. And then my only other thing was just I wanted to ask my seatmates, Tom Cena's out today. Have we seen information from HR about the long-term care options that the board was briefed on? Like what employees would have to do to apply for the alternative trust mark thing? Because the timeline on that is extremely tight at this point. We're in September and you need to have that dialed up in October in order for it to be quote unquote active by November 1st. And I think employees are going to need a little bit of time to react to that and get their applications in. I haven't seen anything, but sometimes I miss emails that Tom Cena goes through, but I don't think in this case that she would have let that go by.
I haven't seen anything either. I can follow up with Maria.
Okay, I appreciate that.
I haven't seen anything. I think that Maria did say she was gonna get back to us with more information. We just haven't seen it yet.
Yeah, I'm just saying the timeline is starting to dwindle.
It's short.
To get your alternative policy qualified and then being able to exempt the payroll deduction. Okay.
I haven't seen any information either. Is there going to be a process or timeline on how we're going to get this information out to employees and how we're going to inform them of this?
I'm going to check with Maria.
Okay.
That was a briefing that I was not able to attend, so I'll do that today.
Okay, great. Well, then we're done for this work session. We will be back at 11:30 for a short budget informational session. And then I think that's it for today, right?
Yeah. Yes.
And we'll be back for the budget all day tomorrow.
Yep.
With that, we are adjourned. Thank you.